Hey guys, what's up? I know it's been a minute. I posted the day before surgery. I wanted to give it a little bit to set in and heal a bit. I took pictures as the days went, but I had surgery on September 27th. I am in a few hours, like 2 weeks post-op. Everything's healing great. Warning, I will show show my chest. So if you're under the age of 18 and your parents don't want to see it, if you want you to see this stuff, then maybe you should tune out of this video. Otherwise, if you don't like seeing scars or like scabs or incision sites and hearing about recovery and everything, then maybe you should also not watch this video. If you're cool with all that, then great. So update, obviously I've come a long way in my transition. I started off as like little and now I'm like 2 years older. I drastically have changed. I have a beard now. I think my head looks different. Voice is definitely deeper. I got top surgery. So yeah, going into my experience with Dr. King in Madison, Wisconsin, that's who I went to. It was all around great. Went to my consultation. Everyone was very warm and welcoming, and it was just, they were there for me, and you could tell that they were there purely for me and the comfort of me. I went in with a bunch of questions, got answers right away. I asked about recovery time, who can be in the room with me, how long the surgery was going to take, exactly what was I going to be feeling, and different things that I had to take before and after surgery, when I could stop things, when I could start things again, and all around it was great. For those of you who don't know, I am a server and bartender, as well as a cook, so I kind of always am moving. I'm always lifting things, and I'm also 22 years old, so work's kind of a big deal for me. I can't really just take 2 months off, but he made sure that everything was kind of quick, painless, and good. So with that being said, step by step, everything that I went through. So we got to Madison, Wisconsin on Wednesday night. I went to the House of Rock and went out to Olive Garden, even though, I worked there, but it's okay. Went to Olive Garden, ate a little bit. I had to stop eating around midnight, and I had to stop all liquids that were not clear after 8:30 in the morning. My surgery was at 10:30. So I get there at 9, and I'm sitting there, and then finally they take me to the back, and, I feel like I was more calm than my family, but really inside I was just excited. I was just ready to go. Let's do this, But finally, the nurse came in. They stuck me with an IV, got me all situated. I met the anesthesiologist. I cannot for the life of me remember his name. It was kind of little, and I want to say it's Sanjay. Don't quote me on that, I don't remember. But he was great, he was nice. He came and talked to me, made sure everything was calm. They verified who I was, and it was great. And then Dr. King came in. He marked everything up to like what it needed to be and made sure I was okay. One thing I liked about him is everything was very comfortable. It wasn't like I had to feel uncomfortable. He always made sure I was comfortable and that those that were around me were comfortable. So in your room, you're only allowed 2 people maximum. Well, I had 3 people with me. Now, that's not really a big deal, but some hospitals and some staffs are like, no, the rooms are small, don't do it. But his staff let my aunt, as well as my mom and my fiance, come in. So that was great. And just having them there with me and not having to like rotate who comes in, who comes out, who does this, who does that. But once he came in, it was like go time. Like at that point in time, I think I had a total of 10 minutes. Then they came back in, gave me the good feeling drug. I don't remember what it was called, but I know it's a good feeling drug. I actually quite literally don't remember leaving the room. I vaguely remember getting into the surgery room and then saying my name and my birthday, moving from one table to the other, watching them pull up the arms, and then I was out. So I can't really give you like a good description what was going on. I do know that everyone introduced themselves to me, told me what they were gonna do. Do I remember it? No. I just know I went under the knife. When I came out of surgery, one of the things Dr. King says, he keeps you overnight. Not like completely overnight, but like 23 hours. That's the max that they can get away with so that your insurance covers it fully, which mine does. I have Blue Cross Blue Shield of Michigan, PPO. So they covered it all as long as I didn't stay completely overnight. So I stayed 23 hours, and I think I actually technically only stayed like 20 hours, but I was covered for 23 hours. So I got out of surgery, and immediately I think I asked to go to the bathroom, but he puts a catheter in you so that you don't get out of bed at all that day. So my surgery was finished at 12, and I was not allowed out of bed until 12. So that's a whole 12 hours in bed, which helps a lot actually. Like it annoyed me, it did, but it does help. It lets you relax. It lets the drugs kick in. It lets them see how you're doing. They keep you elevated. They watch you. They make sure everything's going on. I do also remember having applesauce and then trying to have toast, but because they put a tube down your throat, it kind of hurts. So I guess one of my recommendations is after you get out of surgery, for the good first few hours that you're awake, try not to eat too much solid foods. And then when you are offered food, try to keep it soft. I had a quesadilla, and I could not eat it. Like, it was good. Don't get me wrong, it was good. But, yeah, it just sucked. I had a bunch of applesauce after that, and that's how I was able to keep hydrated and, healthy. They did pump me with a lot of fluids because I wasn't eating. So when it came time to have the catheter out of me, I was going constantly. One thing with Dr. King is he won't release you until you go by yourself. So make sure that if you're one of those people that don't like catheters and you can't pee afterwards, that you try to at least drink a lot of liquids right before they take it out of you. But as for the surgery itself, I came out of surgery. I had my compression vest on. I had the drains, and everything just felt, great. I didn't feel like I had the surgery. Like I wasn't in any pain. It felt like a binder. It was there. I definitely felt lighter. It was a lighter experience. It kind of got weird because like your body is used to pumping all this blood and all this circulation and doing different things, and you get used to it. And then like when you're going to sit up or you're laughing or you're doing something, like you have to catch your breath sort of, because your body is not really used to it. Like 2 weeks out, I'm pretty used to it now. I'm doing great. Actually healing phenomenally. I haven't had to take any pain meds. I went back to work Sunday. Light duty, of course, nothing above 10 pounds, and I won't lift my hands above my head, but I did go back to work, and I am, working normal shifts. I'm not working part shifts, and for the most part, I don't really need help. When it comes to lifting heavy stuff, yeah, I do, but I get it done. Other than that, a lot of, people that undergo top surgery, they are still laying on their back, and it's a part of their discomfort. If you are having discomfort, one of the things that I do is I prop up a pillow behind me, and I lay it kind of on my side, and then I have another pillow right there in the front of me. That way it's like my shoulder isn't completely supporting all my weight, because that's another thing that hurts a lot, like your shoulder, your collarbones, or your back. I actually have reached a point where I can take a pillow, a small pillow, stick it on my stomach, lay on top of that so that the incisions aren't touching the bed or the pillow, and then it's fine, and I don't have to worry about being in pain or having my back hurt. Or for me, I'm a mouth breather, so it's like waking up from surgery, having that dryness, and you know, the constant feeling that something was just in your throat, and gasping for air, or you know, getting really sick and getting really sick and having a really bad cold. So for me, that works. I know a lot of other people that underwent surgery, they're still laying in recliners and having a bunch of pillows, and you know, I get that. But if your back's hurting, definitely try to lay on the side. You have to stretch it out in order for your back to actually, you know, be relaxed. It has to stretch out. It has to have some of that tension off of it. So if you can, stretch it out. If not, then don't. Definitely if you have drains in, don't. I got my drains taken out the very next day, so I was able to alleviate some of that stress. Dr. King, the day after surgery, so long as you're not draining a lot, and you shouldn't, because they keep you comfortable and elevated, and he will not let your blood pressure go high. If your blood pressure goes high, then whoever stays with you overnight, which you're allowed one person to stay overnight with you, has to go to the waiting area. They have to get it down. You have to relax and then decide on if they can come back in. That didn't happen to me personally, but I have heard stories about it. So make sure whoever you're bringing with you is going to keep your blood pressure low. If your blood pressure is low, you won't bleed as bad. If it's high, you're at risk for blood clotting and a hematoma, and even worse, you could rip a stitch because it just clots so bad. Also, you don't want the stress while you're in surgery or out of surgery. When you get out of surgery, you become needy. I'm not really a needy person. I'm pretty independent, but I had to have someone take me to the bathroom all the time. I had to have someone shift the pillow, get the remote if I dropped it. I had to have someone grab my water, refill my water, rotate the pillows, fluff the pillows. Like, it was crazy. Another great thing about where Dr. King sends you for surgery and after surgery, they're all very friendly. Like midnight crew, day crew, all of them, super friendly. They care about you. They put your needs before you, and I'm not sure of a lot of hospitals that do that, even around where I'm from. I live in Indiana, but they care. They want to make sure that your recovery is the best recovery. So they make sure that you are all set, that you're warm. If you're too hot, that they make sure you're cool enough. If your room's too small, they'll accommodate you and make sure it's bigger. For those that have claustrophobia, like, they're ultimately great all around. If I had to have the surgery again, I'd pick them in a heartbeat. I don't, but if I did. What else? Common questions. He does accept a lot of different insurances as long as you're in the network. As long as he's in your insurance network, he'll accept it. He will tell you though, like, say your insurance has an out-of-pocket cost and they'll only cover about 70 to 80%. When he puts it through insurance, and that's all surgery is, not just, you know, it's multiplied. I think he said it's 3 times the amount that he'll charge you just out of pocket. I'm not sure. I didn't really pay too much attention to that because I have insurance, but he said that it's more. So you could end up paying more for the surgery than if you just paid out of pocket. So make sure you do all your research, not just with him, but with all your surgeons. Like, if your insurance says they're only going to pay X percentage amount of it, make sure that the amount that they're charging your insurance isn't greater than the amount that they'll charge you out of pocket, because you may end up saving money if you pay out of pocket. So do your research. Make sure you go to different surgeons, do all that. I went to Dr. King because he's the best in the region. Not saying that Dr. Shore or Dr. Schneider in Chicago, or even the doctors in Indianapolis or in Springfield, Illinois, aren't great, but Dr. King has a bunch of awards and all that, and I did my research. I liked his results best. I liked his ratings the best. So make sure you're comfortable with it. Don't do it because your family says that it's gonna be closer or it's the easiest. Like, just, this is your decision. This is what's gonna make you happy. You do your research. You go to who's gonna give you the results. That's gonna get you one step closer to that body that you have in your head, to that outside appearance that you've been dreaming about. And I couldn't be happier with my results. Over the moon. So as far as leaving the hospital, went straight to my first post-op appointment. He took off the drains, he took off the compression vest, and I saw the bolsters that were holding my nipples. And from there, he told me that I had to keep the compression vest on when I'm sleeping or when I'm around toddlers and animals. That went on for 6 days. Then I went back to him, got it taken off, and I don't have to wear it anymore. I just healing. So I got my bolsters taken off and the vest off. It's the first time I saw my nipples. They looked. My fiance and my best friend said that they looked like burnt pepperonis. I think they said either pepperonis or bolognese, something like that. So I was like, okay, well, they're gonna change. So now it's like almost 2 weeks, and the left one has absolutely no scabbing. The right one is still scabbing, but all around, the incisions are flattening out, to the point where there's just like a very faint bump, and then there's nothing. There's no pain. However, I don't have any feeling in parts of my body. I'll show you in a minute, but if you have any other questions, comments, concerns, put them down in the link. Message me on Facebook, Instagram, Snapchat, whatever type of social media you are viewing this on. Also, I'm going to try to do a voice comparison video. It may just end up being sound clips, but I'll try to get it in there so that you can see the drastic change that I hear constantly. But other than that, any questions further into Dr. King, I will be more than happy to share with you. I constantly will be updating about my progress and where I'm going and all that. Also, do not mind my chubby belly. I like a lot of food. I dig it. It's nice. But I also gained a lot after surgery. That's another thing you'll do, for those of you currently going through it or will go through it. When you have surgery, you can't do much but sit there and watch and eat. You have to eat to take your prescription, and you eat when you get bored, watch movies. You'll gain weight, and then as soon as you're cleared to go back, you'll lose it just as fast as you gained it. So don't worry about it. It'll go. I hope. Eventually it will. So yeah, just shoot me any questions. Okay. So this is almost 2 weeks post-op. As you see, it's still a little red. It's not too bad. This one still scabbed. This one's pink, so it's not too bad. It's actually really soft. He cut all the way to the side, and then it kind of bulged out. It's swollen still there. Um, I have a lot of mobility. I don't move much, but I can go like this. It stretches right here. That's about it. That's about the only discomfort is the stretching from the scar. But it gets better. Like, it used to be like all of this was tight. Now it's flattening out. It's thinning. It does bunch up a little bit, but I wore the vest all the time, so I think that's what it was. It actually was a little bit worse. Like, this was like a full dent, like that, and now, like, as I move, it stretches out. So it's getting there. It's becoming less tight. Definitely pretty happy with my results. This was like an indentation. It's not now. It's just a bump. I don't know if you can see it. So it bumps out, and it used to be like out to here. Now it's like an in. I don't have any feeling right here, all the way to here, and here. I started getting feeling right here, but that was like yesterday. I still don't have feeling right here though. That's because my nerves are still healing, so it's not really much to worry about. From what I read, it's gonna take like 8 weeks for all the nerve endings to get there. That's probably why you can't lift 10 pounds or lift above your head a lot, because those nerves still need to connect, and they need to build that tissue on top of it, and your muscles need to get back there. Like, I had some pretty nice pecs, and it's kind of just like there. So, yeah, it's my progress. I like it. I'm pretty content with it. Can't wait to get like my chest piece and get this covered up. It's kind of botched, but you know, tattoos, tattoos. So if you have any questions, let me know. Concerns, let me know. If you didn't like the incisions, well, I warned you about it, so don't let me know. I will delete all comments about that, because I did warn you in the beginning of this video. But, yeah, see you next time, guys.